Good morning, everyone. My name is Calandria, and I am the Patient Care Coordination Manager at Innova Psychiatric Assessment Center in Fairfax, Virginia, here in the United States. My research is on the effect of CBT existential therapy for a client with PTSD, ADHD, and existential anxiety. The integrative CBT existential approach combines the structured technique of CBT, cognitive behavioral therapy, with the philosophical insight of existential therapy to enhance therapeutic relationship and address existential concerns, ultimately improving outcomes. Integrating mental health into the broader development frameworks is crucial for achieving the United Nations Sustainable Development Goals with culturally sensitive adaptations such as incorporating Eastern philosophies, ensuring better support for diverse population. In the Philippines, declining mental health scores, persistent stigma, underfunding, and limited service access highlight the ongoing challenges in the mental health. Despite overlaps between existential psychotherapy and CBT, there is a research gap regarding the application of an integrative CBT existential approach for Asian clients with complex comorbidities like PTSD, ADHD, and existential anxiety, which this study actually would seeks to address. This experimental study investigated the effectiveness of integrative CBT existential therapy as a therapeutic approach for individuals with comorbid PTSD and ADHD accompanied by severe existential anxiety. The results will address gaps in integrative CBT existential therapy research and contribute to a comprehensive model, including a treatment manual for practicing psychologists and therapists. This CBT existential therapy manual will provide existential baseline data that is effective and tailored interventions for individuals with these comorbidities. Further, a separate publication of a self-developed existential anxiety questionnaire will benefit the Filipino population since this psychological instrument is actually culturally designed, incorporating Filipino philosophical social norms. The design of this study utilized an ABA single subject experimental design to systematically monitor a defined target behavior, an area of depressive symptomatology across baseline or pre-treatment period, intervention stage, and reversal phase to establish causal explanation for behavioral change observed following the intervention stage. The participant of this study was a 20-year-old woman from a highly urbanized city in the Philippines with diagnosis of comorbid ADHD, predominantly actually inattentive type, PTSD, and severe existential anxiety. The researcher employed purposive sampling to select a deviant case referred by his local psychological clinic, enabling in-depth exploration of unique factors and refining theory in a single subject design, while streamlining data collection and leveraging the participants' comprehensive case understanding. For the instrument, the standardized assessment instruments that had been used were the National Stressful Event Survey PTSD short scale to monitor the PTSD symptoms, the ADHD Clinical Outcome Scale, also known as ACOS Clinician, to monitor the ADHD symptoms, the Hopkins Symptoms Checklist to monitor the depressive and anxiety symptoms, and the self-developed Existential Anxiety Questionnaire to monitor existential anxiety, and the Personality Inventory for DSM-5 brief form to monitor and assess maladaptive personality traits, focusing on the 5 areas of negative affectivity, detachment, antagonism, disinhibition, and psychoticism. For the data collection procedure, there are 2 stages in the data collection: the pre-experimental or preparation stage and the experimental stage. The experimental stage involved 3 phases: pre-intervention, intervention, and the post-intervention. The pre-experimental stage focused on building rapport, assessing the client's symptoms and relative clinical demographic factors, conducting comprehensive medical and psychological evaluation, securing informed consent after explaining the study, and performing baseline testing to ensure accurate diagnosis and holistic care. During the experimental stage, in the pre-intervention phase consisted of a comprehensive 9-day baseline assessment of the client's co-occurring symptoms, including existential anxiety, depression, PTSD, and ADHD, monitored by a registered psychometrician and supervised by a psychiatrist to establish a stable clinical profile. In the intervention stage, the participant received brief integrative CBT Existential Therapy, targeting her comorbid condition twice weekly for 6 weeks, with treatment individualized to her needs. The post-intervention phase involved a 7-day return to baseline period with ongoing symptom and vital signs monitoring, but no active treatment is administered to assess the maintenance and stability of therapeutic effects compared to the baseline. The data analysis, the data were organized for visual representation, as graphical analysis was a central interpretative method in single case research. Visual analysis of graphical data supported by numerical values enabled the interpretation of symptom trends and fluctuations over time, with indicators like behavioral level, trend direction, and data variability used to assess the effectiveness of the intervention. For the results of the summary of the findings, the participants' vital signs throughout all phases, throughout all the 3 phases, the participants' vital signs, including temperature, pulse rate, oxygen saturation, and blood pressure, remain within normal limits, with only minor, non-significant fluctuations observed. No fever or infection was detected, and body temperature did not surpass the fever threshold at any point. Although a slight increase in average pulse rate was noted compared to the baseline values, but these values remain stable and within normal range post-intervention, except for a single non-critical low reading. Oxygen saturation and the blood pressure all stayed consistently normal, indicating that the integrative CBT existential therapy did not negatively impact the participants' physiological status, underscoring the safety and the non-invasive nature of the intervention, even in the context of a comorbid PTSD, ADHD, and existential anxiety. The psychological monitoring, there is a routine mental status evaluation. At the start of the monitoring, the participants showed symptoms of ADHD, PTSD, and existential anxiety, but maintained normal appearance, intact sensorium, and coherent thought process, despite a dysphoric mood, sad expression, and preoccupation with relationship stress. Her cognitive abilities remain unimpaired, though she actually struggled with self-control and relied on others for support. For the visual analysis of the participants' anxiety and depression level, visual analysis using the Hopkins symptom checklist revealed that the participant experienced clinically significant anxiety and depression at baseline, with T-scores indicating moderate to severe anxiety that decreased steadily during integrative CBT existential therapy and remained low post-intervention. Visual analysis per Miller confirmed a clear division between baseline and intervention phases, suggesting that therapy produced a reliable and lasting reduction in anxiety symptoms, a finding supported by related literature emphasizing the effectiveness, stability, and durability of integrative and existential therapeutic approach. The visual analysis of the participants' depression levels showed that these scores were consistently high during baseline, but declined substantially during integrative CBT existential therapy, with the most significant reduction occurring toward the end of treatment. All those symptoms partially increased after therapy ended, but they remained lower than the baseline, supporting the effectiveness of the intervention in reducing depressive symptoms and highlighting the importance of ongoing support for lasting benefits. The visual analysis of the participants' existential anxiety showed that the participants' existential anxiety remained at a moderate, clinically significant level across all phases, with these scores averaging 34.22 at the baseline, 37 during the intervention, and 36.86 post-intervention, reflecting the complex nature of existential work, where increased anxiety may signal productive engagement, actually, with core issues of meaninglessness, for example, and supporting research would suggest that existential and meaning-centered therapies can actually initially heighten distress, but ultimately provide relief, especially with ongoing support. Visual analysis of the ACOS clinician showed and revealed a distinct and sustained reduction in ADHD symptoms and related functional difficulties during and after integrative CBT existential therapy, with no overlap between baseline and intervention phases, indicating treatment effectiveness and durability according to Miller's criteria. This pattern indicates maintenance of generalization of treatment effects, which is highly desirable in clinical practice. According to Miller, according to his principle and recent research, a lack of return to baseline is often interpreted as evidence of the durability and real-world impact of the intervention, especially for therapies that teach skills or foster new perspective rather than simply suppressing the symptoms. For the visual analysis of the ACOS in attention and functional difficulties, the data scores demonstrated a clear and sustained reduction in inattention symptoms and functional impairments during and after integrative CBT existential therapy, with most intervention phase scores consistently lower than the baseline and only minimal overlap post-intervention, supporting the therapy's effectiveness according to Miller's visual analysis criteria and the scale's reliability in ADHD assessment. For the visual analysis of the participant's severity of PTSD symptoms, the data points from the single subject ABA design showed that the participants' PTSD symptoms, as measured by the NSESSS PTSD, decreased from stable moderate levels at baseline to mild levels during and after integrative CBT existential therapy, with a clear division and stability between phases, indicating the intervention's effectiveness and durability according to Miller's criteria and supported by recent research, highlighting the sustained clinical benefits of integrative approaches. For the participants' negative affectivity scores, it showed a clear and sustained reduction from a high baseline mean 2.8 to moderate to high means, which is 2.4, during and after integrative CBT existential therapy, with no overlap between baseline and subsequent phases, demonstrating a clinical and a meaningful and lasting improvement in emotional regulation and psychological health as per Miller's criteria and recent research. Visual analysis of the participant detachment score indicated stable but overlapping values across baseline, intervention, and post-intervention phase, ranging from 1.6 to 2, which according to Miller's criteria demonstrates no convincing division or meaningful effect of integrative CBT existential therapy on this personality trait, with recent research confirming that clear separation between phases actually is actually necessary to attribute the improvement to the intervention. For the visual analysis of antagonism, the scores showed stable values within each phase and a clear non-overlapping reduction from a moderate to very high baseline mean, which is 1.8, to a lower mean during and after the integrative CBT existential therapy, which is 1.12 and 0.96 respectively, providing strong evidence of meaningful and lasting reduction in antagonistic traits according to Miller's criteria and recent research. For the participants' disinhibition scores, the scores revealed only a modest and overlapping reduction from baseline, 2.8 to intervention and the post-intervention phase, which is 2.6 and 2.4. With stable but still high scores indicating that integrative CBT existential therapy did not actually produce a meaningful or convincing improvement in disinhibition according to Miller's criteria. So for the psychoticism, the visual analysis scores showed a modest and stable reduction, but from the baseline to the intervention and post-intervention phase, but the presence of overlapping values between phases actually means that the improvement is not convincingly attributable to integrative CBT existential therapy according to Miller's criteria. But if you can see the overall score, the visual analysis of the participants' overall score demonstrated highly stable data with each phase and a clear non-overlapping reduction from baseline mean, which is 2.3, to intervention, which is 1.91, and the post-intervention, which is 1.8, providing a strong evidence that integrative CBT existential anxiety therapy produce meaningful and lasting improvements in overall personality functioning of the patient according to Miller's criteria. As a conclusion, the findings of the study show that integrative CBT existential therapy can be delivered safely and effectively with no physiological reactions, as demonstrated by the participants' stable vital signs in all phases. Psychological monitoring of the participants showed substantial lasting effects in the areas of anxiety, depression, ADHD symptomatology, PTSD severity, and the specific maladaptive personality traits, including negative affectivity and antagonism. And this impact was well supported by Miller's visual analysis criteria. Miller's visual analysis is a suitable analytic method for representing not only the significance and the clear division of data of the changes taken, but also the causal relationship to the intervention. The study also demonstrated that the intervention provided greater self-awareness and coping with existential anxiety without increased distress. But continued support is recommended for stable mood and existential adjustment. Nevertheless, on personality domains only on detachment, disinhibition, and psychoticism was the therapeutic effect observed, with which indicates that integrative CBT existential therapy is effective and safe for people whose comorbidities are complex, but they may actually need adjunctive strategies for personality features. The fundamental conclusion is that integrative psychological intervention is an effective, safe, and non-invasive treatment option for complex clinical profiles, but continued personalized and specific support and follow-up is necessary for holistic long-term outcomes. For the limitation of the findings, a key limitation of this study is its single subject, case-based design, which restricts generalizability of findings and makes it difficult to rule out other factors such as natural recovery, expectancy effects, or unmeasured environmental influences. The absence of a control group and reliance on self-report and clinician-administered measures may introduce response bias, and physiological data may not capture subtle changes from psychotherapy. Additionally, the short post-intervention period and limited follow-up do not allow for assessments of long-term outcomes or risk of relapse, while some personality domains such as detachment, disinhibition, and psychoticism showed little improvement. Finally, environmental factors beyond the researcher's control, including the participants' refusal of medication and the decision to remain with an abusive partner during the study, further complicates the interpretation of results and underscores the importance of respecting participants' autonomy in the research process. The utility of this study lies in demonstrating that integrated CBT existential therapy is safe for patients with complex psychological profiles, for example, comorbid PTSD, ADHD, existential anxiety, without resulting in negative effects on the physiology of the patient, for example, the temperature, pulse, oxygen saturation, and blood pressure, which is stable across all phases during the therapy. This shows that we can apply these therapies in clinical practice for high-risk population without added concern for adverse effects on core vital signs. The same monitoring framework is employed on this study to inform the tracking of psychological and physiological changes from the therapy and ultimately guide mental health professionals in delivering psychosocial interventions that can simultaneously improve patient safety and help mitigate emotional and behavioral changes. For the direction of this research, these results provide a basis for incorporating integrated psychotherapy with the daily monitoring of health, whereby patients and providers alike may be encouraged to believe that psychological treatment need not be a hindrance to physical health. The findings also support the role of continuous physiological monitoring as one of the main components of a holistic mental health care. Monitoring of the patient's physical well-being is a key aspect in ensuring that the treatment provides the client with an added layer of safety necessary to continue to show these therapies are safe and non-invasive. Future studies need to include actually larger samples, control groups, and longer follow-ups to confirm these findings and thoroughly evaluate the long-term safety and efficacy of integrative CBT existential therapy. And these are the references I use in this presentation. Thank you very much.